Good, I'm doing well.
Good.
That's where the commissioner's supposed to stand. You're supposed to be further down that way. No, you're on the right wall, just down a little farther. Because he's before you, John, sorry. Well, good afternoon, everybody. Thank you very much for joining us here for our briefing on how the state is responding to the coronavirus and what we're doing to slow the spread here in Nebraska. And with the snow outside, it feels like the only thing that is normal in Nebraska is the weather. Here we are in the middle of April, and it's snowing, just like it always does to us. Crazy weather this time of year. As always, want to start off by reminding people we're on day 7 of our 21 days to stay home, stay healthy, stay connected, that we've got our 6 rules that are not up here actually, but again, the 6 rules to stay healthy are still the same. They're stay home. Only take errands that are essential. 2, work. We want people to work. Work from home if you can. If you're going into the workplace, keep that physical, social distancing, all those guidelines in mind. And notice how far the commissioner and I are standing apart. Make sure you're following those guidelines. Number 3, shop once a week by yourself. Have a list. Be prepared. Go out, get what you need, and come home. 4, help kids socially distance. Keep them at home to play. Avoid playgrounds and group sports. 5, help seniors. They may need errands run for them. So help them by running those errands or going shopping for them so that they can stay home. But don't go visit them in a nursing home. And 6, exercise daily at home or with an appropriate socially distanced exercise program. So again, we want people to follow these 6 rules to keep Nebraska healthy. To start off today, I think I will also just want to hit upon some of our how our social guidelines have impacted our Google mobility. These are some of the numbers we've had over the last 3 weeks or so. Just to hit, if you look at like retail and recreation, down 39% from the baseline in January. So that is actually that's stable. I think it was down 40% last week. Grocery and pharmacy is up a little bit. So again, that's where we want to remind people, shop once a week, go by yourself, be efficient, have a list, go to the store, get what you need, come back home. Parks is up 52%. I think that was up 56% before, so that's actually come down a little bit from the last time. If you look over here where we got the transit down 21%, I think that was down a little bit more. It was down 24% last week, but again, we don't have a lot of the public transit. Probably not as important for us here in Nebraska as it is to places like New York. And then workplace down 29%. That's stable, so that's about where it was before. And the residents up 11%. So that's actually higher than it was before. Again, that indicates that people are staying home, following our guidelines around stay home, stay healthy, stay connected. People are staying home. Great to see that. And again, we want to just remind people we're really putting a focus for to the end of April here, the next 14 days, to really focus on that stay home, stay healthy, stay connected, to make sure that we're slowing the spread of virus here in our state. Now, also along those lines of fighting the spread of virus in Nebraska, many of you are probably familiar that the CARES Act was passed, that will be providing money to the states to be able to fight specifically coronavirus. We have received $625 million here at the state of Nebraska, which represents the first part of that payment. And while we've gotten that money, we have not received any guidance on how we can spend that money. So we're still waiting from Treasury to give us some guidance with regard to that. But at least the first half of that payment to the state of Nebraska has been received to be able to help us pay for the things that we're doing to be able to slow the spread of virus here in our state. So that's good news there. We're expecting to get that guidance probably over the next couple days from the Treasury. And of course, we'll be putting programs together around how we're going to be using that money to be able to help slow the spread of virus here in our state. Next, we've talked a lot about schools. Schools are operating without students until May 31st, and extracurricular activities have been canceled until May 31st. Also, I issued an executive order that prohibits club sports till May 31st as well. Again, the idea is we want to make sure that we're not mixing those groups of kids in team sports, one of our 6 rules, right? So we've tried to make that uniform between club sports and extracurricular activities at the schools. Now, we're getting a lot of questions about, well, what about graduations for seniors? And again, this is something that the Commissioner Bloomstead, who's joined us here today, is going to talk about that and some of the other things with regard to schools. You know, we want people to continue to remember our social distancing guidelines. You know, for example, Red Cloud had a graduation ceremony, but they only had 9 seniors. So they just had those 9 students, and all the audience was in their cars with the windows rolled up. So there are ways to be able to do it if you only have 9 seniors, but obviously not everybody can do that. So for example, at Wahoo, they turned on the lights at the stadium, and they did that in, I believe, in Sterling as well for Sterling Rising City. So again, turning on lights to recognize the seniors is a great way to help recognize the seniors who are graduating, but also keep that social distancing so that you don't have that mixing of people that will spread the virus. So with that, I'm going to go ahead and turn over to Commissioner Bloomstead, who's going to say a few more words. Thank you, Commissioner, for being here.
Just again, thanks, Governor, and thanks for the ongoing leadership in this area. I just would highlight, obviously, for schools and the level of disruption that's taking place across the state for families and for the employers and all of those different fronts. Schools are well aware of the types of challenges that we're facing, and so we're really trying to work very closely and together with a lot of different school leaders. Just yesterday, I met with my advisory group, which consists of 24 superintendents from across the state, to have conversations about really some key things that are happening in education. Number one, how do we help keep families safe and informed and part of regular connection? That's been a really important thing. Number two, really where are we going for the end of the year? And I'll talk a little bit more about that and what the end of the year is really looking like for schools. Three, really what's summer school time and what's summer look like given the conditions that we have. And then finally, what's fall and re-entry into a fall really look like. So first, I really want to hit on this point, and the governor hit on this I think it was last week, about the declines in reports on abuse and neglect. And so we've really talked among the education community about how we can continue to do essentially wellness checks with families as part of our regular routine, ensuring that families are doing well and that there's conversations taking place. I'm working with Stephanie Beasley, who's the new director of Children and Family Services at DHHS, and having conversations about how we continue to do that work together. Obviously, there's a critical health need and feeding that's taking place across the state, and schools are a huge part of that conversation. We'll continue to work with those partnerships. I've been very appreciative of the governor's wife, Suzanne Shore, has been part of conversations about regionally how do we help structure a recovery and a response to the current environments that we face, and schools have really been engaged in that. And I appreciate also ESUs, our public and non-public schools that have been involved in these conversations. So I just really wanted to highlight that we'll continue to do that work. Next, really on how we end the school year, and as the governor said, there's a lot of questions coming about graduation, and there are very few schools that maybe have just 9 students or less to run the typical kind of setting that we may have. By the way, I went to a school, I had 12 in my graduating class when I grew up in Southwest Nebraska. So the reality is it's a challenge right now, but we encourage folks to follow the 6 rules, as the governor just said, follow the DHM, right? And then if you can't have a physical graduation, schedule it later. We've seen a lot of school districts scheduling in July and otherwise, and focus your time and energy on things that we know are already safe. Virtually, what you can do to recognize students in cars, as the governor mentioned as well. But instead of being so worried about trying to pull something off right now when we're still at a peak of our spread, let's be thoughtful about what our role and responsibility to stop that spread. And I think that common sense approach will make us go a long way. Schools are also ending their year. We have school calendars that are not all consistent across the state, so they have different timings that that happens every year. That's not unusual. Schools, by rule of thumb, I've asked them to use their end of their calendar year as they had scheduled in order to move forward and make decisions about how they end their school year. I think schools have done a very good job of understanding the competencies that students are accomplishing right now, especially our graduating seniors and our high school students, making sure that they're getting their credits as we would expect in the school year. But there are certainly schools that are concerned about summer school, and how do we address the challenges typically summer school is used to help students do credit recovery or even advance on credit. And so there's been thoughtful leadership from our schools across the state to think about what summer school might look like, understanding that we have to possibly be working in a remote environment. The governor and I just actually talked this notion of cohorting students or keeping units of students together, similar to what's happened in daycare and similar to strategies, just just to lower the interactions that take place between people. And we certainly want to continue to encourage that as we look at the summer. And then ultimately in the fall, and I think this is really, as we get into the longer term planning, I talked with this group of superintendents, and I believe we'll engage a lot of other players, including the governor, in conversations about how do we know and when will we know what the data looks like so we can start to begin planning for opening in this coming fall. And we have to be prepared that there might be needs for contingency plans and otherwise, but this group of superintendents are really have been very committed to working with me and working with partners that we might bring together. I've had conversations with post-secondary partners as well to look at the data. And by the middle of the summer, sometime perhaps in the middle of July, that we can have a conversation with data elements that we know and understand and can provide some of that planning. In the meantime, it's really important that we organize and plan for the various contingencies that we may have. I'm asking, in fact, even nationally as I'm doing work, of trying to come up with a scalable summer school program, digital materials and otherwise, and I know the governor and I have talked about ensuring broadband and broadband access for students, thinking of a way that we really have an educational safety net for our schools and our teachers and our families ultimately in the long run. And so that work continues as well. I'm really pleased with the efforts that are taking place. It's a nervous point in time for a lot of folks, but thoughtful planning really gets us through these moments. And I'm not going to read from it, but I actually brought it. I was looking at the biennial report from 1918 from the state superintendent for public education in Nebraska, and it's W.H. Clemens because I know he wants that credit right now. But the reality is that this report is much thinner than most of the reports that you see. They were disrupted continuously in education. They worked with health officials, state, and they worked with their governor. They worked with across the board to ensure that there was safety and that they were addressing the pandemic that they had or the epidemic that they had then with the Spanish flu, right? We're not in terribly unusual times. We will get through this. And history to me is just one of those things I love to be able to focus on, but it gives us a chance to reflect that we will get through this. We'll find ways to do that. And I really appreciate what the governor's done to provide leadership in this space and continue to appreciate working with him and working with everyone that's come together. So with that, I'll stop and turn back to the governor. Thanks.
Thank you very much, Commissioner. Now, another educational organization we have here in the city of Lincoln is the Lincoln Zoo. And of course, they have been impacted just like all organizations have been impacted by the coronavirus, and they've been operating without their students or their kids coming in for probably a little over a month now. Is that right, John? So they've been looking at how they can be creative with regard to still sharing the zoo with kids and be able to do that in a way that is going to be socially distanced. And so they've got their Keeper's Corner, which is a video way to be able to have kids look and see what's going on at the zoo and how the animals are getting along and all that sort of thing. So we thought we'd have John Chapo, who is the executive director there, come up and talk about what is going on at the Lincoln City Zoo. So John, I'm going to turn it over to you.
Thank you, Governor. It's very honored to be here today. Like the Governor said, the zoo is an educational institution. That's why so many things of what the Commissioner had shared with us is so important. And because the Lincoln Children's Zoo is a part of this great state, and because the Lincoln Children's Zoo thrives because of this great state and the generosity of all of our communities, we want to give back to our communities as well. So besides the great Keeper Corners that we are doing every day, posting those on social media, the zoo is going to provide free virtual interactive tours to school teachers across the state of Nebraska. So if you're everywhere from Chadron, Falls City, Ponca, you can be able to sign up to get a virtual tour of the Lincoln Children's Zoo interacting with the zookeeper. And the teachers can bring up to 100 students to interact with the zookeeper at the zoo and learn about the animal, ask their questions, and get really involved. That is our goal, because we want to give back. We want to help the teachers out there who are looking for some great curriculum and great ways to connect their kids and keep them home, keep them safe, keep them learning, keep them educated, keep those families safe as well, because that's what it's all about, is being safe and learning all at the same time. So we're very excited about announcing these virtual tours that we're going to be giving out. Now, there's more than 75 teachers who want it. We're going to have to do a lottery, so wait and see how many do sign up. But it's just a great way that we want to give back. Our goal is to give at least 12 to 15 every week, because we know that school is ending in the next month and a half or so, and we want to help out these teachers, these families, these students. We want to keep them educated and keep them connected. So we're really excited to be collaborating and doing this for the great state of Nebraska, these virtual zoo tours.
So John, if somebody is interested in that, John, how do they reach out and get connected to you?
Thank you, Governor. If you're interested, simply go to lincolnzoo.org. lincolnzoo.org. Just click right on there, education, virtual tours, sign up. It's so easy to do. So go to lincolnzoo.org, and we hope to get you to have a great connection with the zoo. Thank you, Governor.
Great, thank you, John. And just to be clear, when you say the teacher can bring 100 students, that's 100 students virtually.
Yes.
It's virtually, so they're not actually coming to the zoo. It's going to be that virtual tour. So thank you very much for that. A couple other things before we get into questions and answers. Just want to hit upon, again, how families in the state have been impacted by the coronavirus. We had, 15,994 new applications for unemployment this past week. We've paid out over $16 million since Sunday to those families who have qualified. So this is something where, again, we continue to see families here in Nebraska be impacted by this and continue to support those families through our Department of Labor. Also, we wanted to highlight some of the good work that other people are doing in the community. We always try to find a good news story like this. AT&T is donating $38,000 to 2 organizations here in Lincoln to be able to help people through this time. They're donating $23,000 to the Center for People in Need, and $15,000 to the People City Mission to be able to help those organizations provide for people here in the city of Lincoln who are facing, we always have people who have got tough times here, especially during this coronavirus. Those folks are doubly impacted, and AT&T is stepping up to be able to help those 2 great organizations that are serving the people here in Lincoln. So a great job, AT&T. And then just finally, a couple of notes. We had to move this up to 1 o'clock Central Time today because the President has a phone call scheduled with the nation's governors. Tomorrow we will return to our normal time of 2 o'clock Central Time. We will also be back here next week. Assuming the President doesn't change times again, we'll keep trying to do 2 o'clock Central Time, but as you've seen, sometimes we have to be flexible with the schedule here, but we'll plan on being back here next week at 2 p.m. And then also tonight I will be on NET 8:30 to 9:30, the program Speaking of Nebraska. We'll have Dr. Ali Khan and Shelley Sweethome from University of Nebraska Medical Center, Nebraska Medicine, talking about, again, how the state is responding back to the coronavirus. So with that, we're going to go ahead and then get into the questions and answers that we have. Our first one comes from Christian Wagner, NTV. What does Governor Ricketts have to say about Judiciary Chairman Senator Lathrop's letter urging him to put a stay-at-home order in place, to keep Nebraska Crossing from opening? So, folks, again, we haven't done that shelter in place here in Nebraska. What we've issued these directed health guidelines, and there are some businesses that we've talked about, like the tattoo parlors and the salons and massage therapists, that we have specifically put in there. But we have not closed businesses broadly here in the state of Nebraska. We are asking people to stay home, especially these next 14 days. That's what we're really focused on. So, but just broadly speaking, we haven't done that anywhere. So we're going to continue to follow our plan, and our plan is working, folks. You can see from the data here how people are staying at home more, they're not going into their office. And we can also see that, again, across the state, and you look at the data here in Nebraska where we have still under 1,000 reported positives, going back to our first positive, March 6th, we have not been impacted here like other states, like New York. In fact, we know that the steps we have taken, these non-pharmaceutical interventions, things like staying 6 feet distance apart, 10-person rule, washing your hands often, for 20 seconds. We haven't said that in a while, but wash your hands frequently for 20 seconds at a time. Staying home when you're sick, and everybody in your household stays home sick. That is sick. Everybody staying home in your household when somebody's sick. Those are the things that are making a difference. And we know that we are flattening our curve and spreading it out. And that's the whole point. And we also know we have not overwhelmed our healthcare system. And that's the real goal, to make sure that anybody who needs that hospital bed, that intensive care unit bed, or that ventilator has access to be able to get that. And we've been able to do that. Our plan is working. Next question was, President Trump says he will announce some reopening procedures for some states today. Does Governor Ricketts anticipate any major changes from the president directed at Nebraska? I do not anticipate, the White House not communicated anything that there's going to be anything specifically directed at me as a part of this. We are starting to have those conversations about what would that look like. Our current program, staying home, right, goes to the end of April. So we will be looking at steps are we going to take in May. But again, I want to set everybody's expectation that we are not just going to lift all these social distancing guidelines all at once. And in fact, we will probably be doing some sort of social distancing for the foreseeable future until there is a vaccination. I don't know what that will all look like, but we can imagine that all these things we're doing to slow the spread of virus here in our state will be ongoing. Now, we will gradually lift these restrictions, but that will be, again, a step at a time to make sure that we, again, continue to preserve our healthcare system, that it doesn't get overwhelmed. That is the whole goal, to make sure that everybody has access to those resources if they need it. Andrew Ozaki, KETV. How much will increased testing and having the capacity to random test play in your decision when loosening up the DHMs? So testing is going to be obviously an overall part of the plan as we think about loosening some of these restrictions. What we're really going to be focused on is the healthcare system. Keeping a look at hospital beds and occupancy rates, how many ventilators are being used, how many ICU beds. That is really going to be the key thing, because that's the end game, is to make sure that doesn't become overwhelmed. Now, testing and being able to do that contact tracing, those are both going to be very important, and we are going to continue to look for ways to ramp those up, because that will help us also get that complete picture about what's going on in our state with regard to the spread of the virus. But the real key is going to be focusing on that healthcare system. When will we have the capability to do random tests? And I think what Andrew means by random tests is doing that community testing. And actually, we have done some of that already. So for example, when we deployed the National Guard to places like Grand Island or Kimball, part of what we were doing there was some of that random testing in the community. We've done some of that through some of our healthcare clinics in Omaha as well. So we are doing some of that right now, but what we really want to do is be able to expand the testing so we can do more of that, to have a better idea of what the prevalence is in Nebraska with regard to how much the virus has really spread. And then how much will you stress to the president that reopening economy should be left to the state and local decisions? And again, I think that we've been working with our federal partners. It's been a great collaboration. We work with our local partners. We try to make this a whole collaborative process about how we approach putting the social distancing measures in place, and then as we start to think about how to lift them, it'll be the same sort of collaborative process, and again, the same sort of step-at-a-time approach to make sure that we don't overwhelm the healthcare system. I got a blank paper here, so that's not going to do me any good. Here we go. Have you asked Nebraska Crossing to delay its opening in view of the Hospital Association's warning? This is from Don Walton at Journal Star. The Hospital Association's warning that planned opening can nullify the state's efforts to corral the virus. So again, I have not spoken with the Nebraska Crossing, but we haven't asked anybody to close. And I think, again, this is the point, is that we are asking Nebraskans to exercise their personal responsibility, their civic duty to do the right thing. Following our 6 rules around staying home, going to work, shopping once a week, helping kids and seniors, exercising. All that is what we're asking Nebraskans to do to slow the spread of the virus, that every Nebraskan can be a part of this effort to slow the spread of virus here in our state, preserve our healthcare system, and protect those folks in our society who are going to be more vulnerable to the coronavirus, our seniors, people with underlying health conditions. We've asked Nebraskans to step up, and you can see from the data they are. So Nebraskans are doing the right thing. So we want to continue to ask Nebraskans to do the right thing. That's been our focus and our emphasis, and folks, it's worked. So we want to continue to doing what we're doing because it's working. We got to continue to stay focused on this, but we don't need to say, hey, this person or that person, you're got to close your business. We got to focus on the plan that we've got right now, and we're going to continue to stick with that plan because the plan is working. So with that, Taylor, did you have other questions that were texted in?
Yeah, we have a few questions about unemployment. Martha at the World Herald said her niece and they have a reader whose niece and fiance got an unemployment check 3 weeks ago and received a communication from the Department of Labor saying the best course of action is not to call them, that the agency would reach out if there were problems. How can they get problems resolved if they're having them?
So the question was from Martha Stoddard at the World Herald with regard to somebody who had contacted them. They'd received a check 3 weeks ago and were told not to call. But right now, they haven't heard back, and they said the Department of Labor would reach back out if there's a problem. I'm actually, because we had the announcement on the numbers, I've got John Albin, the Labor Commissioner here. So John, I'm going to call you up and just talk a little about how to answer Martha's question there.
Well, thank you, Governor. In answer to Martha's question on the person who received a check and then was told not to contact us again, it doesn't sound quite right, but it could just be a miscommunication between everyone. If they were in payment status and they filed their weekly certifications, the check should continue to follow. The only thing that I can think of that might be the answer to the problem is if they had exhausted their prior claim, because we haven't even got all the guidances and workup for the extended benefits yet, the extra 13 weeks, and so it may be that. But if they would reach out, send me the names, and we'll look into their claim.
So John, is it possible to check that online?
Yeah, they should be able to go online and examine their claim and see if there's an issue, and it should show them if there was a payment status as well.
We have another unemployment question from Brian Master at WWT. He said that there's a message somewhere in the Department of Labor system that if people are having problems with their claim, that they could come visit the Department of Labor in person. Does that seem safe while we're asking people to work from home or stay at home?
Well, we're an essential service in this time, and if someone can't resolve the matter through their computer.
question, please, John.
Oh, excuse me, the question was, someone was having a problem with the claim, and they were told to go to the local office, and the questioner was asking if that was a safe practice given social distancing. We are practicing social distancing in all of our offices. To the extent we can, we do the 6 feet distance, no more than 10 in a room. And if you can't resolve your issue over any other way, that is one avenue to go in, because we do have people who can help you with a UI claim in every office.
And then the last question about unemployment is from George at the North Platte Bulletin. He wants to know if the unemployment insurance system is keeping up. There's people who applied 3 or 4 weeks ago that haven't gotten their check yet.
Okay, well,
Repeat the question again.
the question was, is the system keeping up? Because there are people who filed 3 to 4 weeks ago that haven't gotten paid yet. And the system is keeping up well considering what's going on. But you got to remember, the whole standard and the whole UI system is you take 3 weeks, it's at least 3 weeks to process a claim. That's their standard, payment within 21 days. For the first quarter of the year, we were at 90% first payment within the 21 days. We're not going to be at that rate as we go into it. We've hired on an additional, we started out with 32 adjudicators, 34 adjudicators, and now with the recent hire of this week, we just started a new class, and I think we've got up to 200 people now working the claims. So we're going to dig out. We're behind a bit. We're hoping to hit like 75% within 28 days as our current goal.
Governor, we have a question from Madison.
Thank you very much, John.
at 10:11.
I'm sorry, we got a question from who?
Madison at 10:11.
Madison at 10:11.
I'll try to simplify this. During a normal, when schools are operating with students, providers cannot bill for developmental disabled services for DE clients during the school day because it would be viewed as duplication of services. Are we considering changes to this regulation that governs this to allow people to bill for services during the day so they can serve their clients that aren't in school right now?
So the question was for Madison, typically if you're billing, a provider, you can't bill for developmental disability services during the school day because typically it's expected that the young people are getting that service already in the schools. But with schools operating without students right now, are we looking to make a change for that? I don't know the answer to that question, but Taylor, if you could just make a note of it, we can respond back to Madison after we've had a chance to talk with the folks in the Department of Health and Human Services to see what the program is now, if they've made administrative changes or what have you with regard to those developmental disability services. But off the top of my head, I don't know, but we'll get that answer and get back to you.
Chris Dunker, the Journal Star, is asking about the Omaha Tribe is telling media that the state has withdrawn an offer of financial assistance and told the tribes to look to the federal government for help. Do you know what the Omaha tribe may be talking about?
So Chris Dunker is saying that the Omaha tribe is saying that the state has withdrawn a offer of financial assistance to the tribes and have told them to look at the federal government or look toward the federal government. I think there's, the story's getting a little bit jumbled here. We have been talking to the tribes with regard to responding back to the coronavirus and offering them support through things like personal protection equipment and things like that. So the things that we're working with to, through our public health departments to help nursing homes or hospitals or health clinics and things like that specifically. We have told them there's not going to be dollars, specific financial aid coming from the state because there is, as a part of the CARES Act, and the $150 billion that was set aside for states, there was $11 billion of that was set aside for tribes and territories. And so the direct cash payments are going to be coming from the federal government with regard to that. And that's why we've said the state's not going to provide cash financial support, but we're happy to supply things like personal protection equipment if you can't get masks or gloves or things like that. And we've asked them to, if they've got needs, to be able to funnel that back into us. In fact, we assigned a specific person to be able to be their one point of contact with regard to that. So we are offering to provide assistance directly to the tribes from the state, but it's in the form of things like PPE, just like we're doing for other types of clinics.
William Padmore from KLN wants to know, why does Nebraska need guidance from the Treasury on how to spend our federal dollars? Is that a condition of the funds?
So the question was, why does Nebraska need guidance on how to spend the money from the federal government? Again, so the CARES Act is a law, and you have to comply with the law. So, for example, one of the things we've been specifically told is that a state or a local government cannot use those CARES Act dollars to make up a shortfall they have in their general fund budget. And we're looking for the guidance from the Treasury Department on how we can spend this, because we don't want to spend that money in a way that then the Treasury Department comes back to us down the road and says, hey, you didn't spend this right, you got to pay that money back. So whatever money we spend, we don't want to have to pay that back to Treasury because we made a mistake in how it was being spent, and that's why we're looking for that guidance from the Treasury to be able to spend that money so that however it's spent is going to be a purpose that was decided, the Treasury interprets under the law was allowable versus something that was not allowable, and then we have to reimburse the federal government.
We have a question from Maya at KMTV. She's getting calls from employees at Farmland Foods in Crete. They're concerned that their company isn't practicing social distancing. What recommendations does the state have for meat processors that can help with social distancing?
Right, so Maya is getting calls from people from farmland in Crete that they're concerned that their company's not doing enough around social distancing in the workplace. And what kind of guidance does the state have? As a matter of fact, we've set up, and maybe actually this is a good topic we can pick up another time, Taylor, so surprise, our unified command structure. And part of that is going to be working specifically with food processing plants as seeing what they're doing to be able to make sure we're keeping those food processing plants open, because that's an important part of our food supply chain. Obviously, we've seen some of the challenges we've had at some of the plants that are in Grand Island and some of the steps that those companies have taken. So we're working to be able to pull together the folks who are in that industry to be able to share best practices, to offer some of our expertise from the state on what more they could be doing to be able to put those social distancing kind of practices in place in their workplace. As you can imagine, some of this is challenging. So for example, at JBS, I know one of the things they're doing is they're taking the temperature of everybody who's coming into the facility. They're putting up plastic barriers between workstations. They're putting up plastic barriers in the lunchroom so people can eat in what would be kind of like a phone booth. People are wearing masks. They're sanitizing often. These are the kind of steps that we want to see. Oh, and they're sending out communications home with people in English, Spanish, Arabic, Somali, talking about the steps they're taking and reinforcing things like if you're sick, stay home, all that sort of good stuff. So those are the kind of things we want to see in the entire industry and really looking at what are those best practices. So we are working with, looking to work with the entire industry to be able to help them make sure they're doing everything they can to keep their teammates healthy and safe and continue to be operating, because that's an important part of how we feed our state, our nation, and so forth. So this is really important. And I would say specifically, if the folks at Farmland have ideas or guidance in their workplace to be able to share with their supervisors, I would recommend they do that. That they say, hey, here's a way that we could do a better job of social distancing. I'd recommend those folks do that. We at the state are going to be also working with those companies too.
Grant Schulte wants to know if we have any updates on what's going on in Grand Island.
Grant Schulte wants to know if we have any updates with regard to what's going on in Grand Island. The National Guard, which had earlier in the week been down in Hastings doing some testing, again, because we've had some issues or some cases pop up in Hastings, and again, associated with food processing plants. They're back in Grand Island doing testing. They'll be doing testing again in Grand Island at least through Saturday. So we're continuing to deploy resources there with regard to testing. And then I believe, and Dr. Antone, do you have the numbers there? I believe we actually, can you give us some specific numbers with regard to the St. Francis? Because the hospital there, again, we continue to work and manage that. And I would say that we are managing that. Do you just want to come up and say a few words about what the status of St. Francis is?
Somebody once told me that a dull pencil's better than a sharp mind, so I wrote these numbers down. I'm not like the governor, who has a photographic memory, but I am becoming friends almost with the CMO of St. Francis Hospital in Grand Island. And he does text me the numbers in the morning, and I usually try to communicate with him personally before the conference here so I can give you an update. He seemed very, again, calm today. They did transfer out 5 people yesterday, 2 that were COVID-related, 3 that were not COVID-related for other medical reasons. Today, they have a total of 18 COVID-positive patients in their hospital. They have 12 people in their ICU, which is down from about 16 from a day ago. They have 8 COVID patients in the ICU that are on ventilators. Good news is 2 of the COVID patients that were on ventilators were moved out of the ICU to the progressive care unit today, so they are improving. He always keeps track of what's going on from the emergency room that day and the census in the emergency room. He assured me today their emergency room was less busy than it has been for the last few days. So all in all, things to be fairly well under control in Grand Island. I also have contact with the CMO of the Hastings Mary Lanning Hospital, where there also was some issues, but they also seem to be under very good control. They do have a total of 10 ICU beds. Currently, they have 4 of those beds in the ICU with COVID-positive patients on a ventilator. So those are the hot spots in the state right now. Everybody else seems to be very calm. So I appreciate the relationships with the CMOs throughout the state who I almost, like I say, talking to on a daily basis now.
We have 2 questions for John Shapo about the zoo.
So John, we've got 2 questions for you about the zoo. And I'd be remiss if I didn't remind everybody about Dr. Antone's joke about the tiger getting coronavirus and staying 6 feet away.
Easy to do.
Come on up, John.
More than an arm's distance from a tiger. Yes, sir.
William Padmore would like to know, are the virtual zoo tours 12 to 15 per week, 75 teachers per tour, and 100 kids per teacher? How do those numbers all work out?
Repeat the question.
How's the virtual tours going to be working regarding teachers, numbers of students? We will do 12 to 15 virtual tours weekly. Okay, a total of about 75 based upon what our staff can do capacity-wise, a total of 75. They are for elementary age students. It's 1 teacher, and 1 teacher can have up to 100 students participating, asking questions at the same time. Again, like the governor said, if they're not at the zoo, they're virtually connected with the zoo, those 100 with the 1 teacher.
And then he also wants to know what times will those tours be available?
Those are to be determined by the professional staff at the zoo in conjunction with the teachers regarding their scheduling, the logistics. We have logistics, teachers have logistics with connecting 100 students, so we will work dynamically with those teachers to the best of our ability. Thank you, Taylor.
Thank you, John. Okay, so those are the questions we have. Paul?
One, given Grand Island now has the most cases and their infection rate probably more comparable to New York, why did you reject the mayor's offer to let's do stay at home?
So the question was from Paul Hamill at the World Herald. Now that Grand Island, just certainly on a per capita basis has more cases than Omaha, and you said that it was more like New York. I haven't done the math on that. Certainly it's more like New York than Nebraska. That's probably fair. Why did I reject the mayor's ask for a shelter at home? Actually, I got to tell you, in our conversations, neither the mayor nor the public health director directly asked me for that. I think that was done through a letter that they had, 45 doctors had put into the Omaha World Herald. But in our conversation, it was probably, a week and a half, almost 2 weeks ago now, when we were talking about steps to take, they didn't make that direct ask on it. And my subsequent conversations with the mayor, he's been grateful for the work that we've done to marshal resources to the public health district, to be able to do more contact tracing, the amount of testing we've been doing there. Obviously, Dr. Antone's been talking about how close contact we've had with the hospital and so forth. And again, I think that you look at our plan and it's working. Our plan is working. So we are not overwhelming the healthcare system, certainly not in Grand Island, as Dr. Antone just demonstrated, and nowhere in the state are we doing that.
You think, what else could be done in Grand Island, you think, to address this?
So the question was, what else could be done in Grand Island? And one of the things we've done is I've reached out to the major employers in Grand Island. I've asked them to give me what are their plans, what have they done to be able to help keep their folks healthy and safe. What kind of communication are they doing to their teammates to let them know about things like, hey, if you're sick, you need to stay home, and everybody in your household needs to stay home. So again, so the goal for contacting those employers, the other employers, is just to make sure that they're all taking the steps to be able to do that social distancing in the workplace. So again, Grand Island's a manufacturing town, so it's not an easy place to be able to just work from home. Now, many of the employers are trying to get their folks to work from home where possible, but you can imagine in a manufacturing environment that's difficult. So that was just reaching out to make sure that those big employers were taking steps to be able to implement social distancing, just kind of a follow-up with that. So we wanted to make sure they were all doing that and encourage them to think about other ways that could be able to do it. So that's an example of one of the things we're doing. Another example that will not impact directly Grand Island, not just Grand Island, but is just what I just mentioned about trying to pull together all the food processors together in the state to be able to share those best practices. It's not really a competitive thing, right? To make sure everybody's doing what they can to be able to keep their teammates safe. So that's another step that we're doing, along those lines of making sure that we're doing all we can. I know other steps that have taken, we appreciate Dr. Grover has sent out communications through the school district to families. CHI has purchased advertising in multiple languages, both English and Spanish at least, to be able to communicate out. I know Teresa Anderson has done a lot of work as well about how to reach out to families who English may be their second language, and also communicating a way that is going to be more effective than maybe what I was doing through Stay Home, Stay Healthy, Stay Connected. So there's a number of things we've been doing to take those steps in Grand Island to be able to help educate people, to be able to help give them the tools they need to be able to do that social distancing and slow the spread in Grand Island. And as again, the things we are doing are working. We are, and just our call yesterday, I do a weekly call with all the public health directors. We do daily calls with them. Our team does daily calls with them. On one of the calls, I think it was yesterday, Grand Island said that at least, right now we asked specifically about PPE and their resources with regard to that personal protection equipment is adequate in Grand Island. So they're feeling, fine from that standpoint. We got testing going on there again. So we are paying attention to Grand Island. And again, we have not overwhelmed the healthcare system, so our plan's working.
It's time for a few more
Can
questions.
you just, what's your suggestion to President Trump whenever you did?
Well, the question was, what's my suggestion to President Trump? It's his call, so I'm going to let him do the talking. If we get a chance to ask questions, I may ask questions based upon some of the things he said. But, again, when it comes to, how do we look at loosening some of these restrictions, we're going to be, collaborative with our federal partners. We're going to work with our local folks. We're going to be talking to industries about what should that look like, getting suggestions from.
Several governors complained about, there's this kind of competition to buy things like reagent and things like that. Do you think the federal government could do more, coordinate that, help the states?
So the question was, could the federal government do more to help us, for example, buy reagents and so forth? Look, I'm a big believer that you can always do better. Continuous improvement, right? That's what we practice here at the state of Nebraska. I will tell you that my concern is if you turn it all over to the federal government, then states like Nebraska could get lost. Because, we don't have, because of the early steps we took, we are not seeing the same impact as states like New York. And so my concern is if we just were totally dependent on the federal government, states like Nebraska may not get a high priority. So certainly I think there's things the federal government could do to improve upon it, but asking us to go out and get the reagents we need specifically for the machines, for example, that we have, is a decentralized way to do it that I endorse.
We have 2 more questions.
2 more questions. So, John, then we'll go to Lee.
I don't know if you've had a chance to see it, Governor. 14 state senators sent you a letter asking you to do a number of things, including immediately include grocery store workers, pharmacy workers, food production workers in your definition of frontline emergency service providers. Is that something you would consider doing? Would that benefit them in any way?
So, again, I've seen the letter. The question was about a letter some senators sent me with regard to things they would like me to do. And by and large, we've done everything that they actually asked already. And so my guess is, I'm not exactly clear on what they mean. We haven't necessarily determined essential workers here in our state, right? We've said there are specific guidelines we're looking for people to do, but if they mean...
Would they be maybe prioritized for testing or anything in that nature?
Oh, prioritized for testing?
I'm not sure if that's what they mean, but that's
Yeah.
what I mean.
Well, again, I guess from the letter, it wasn't clear to me what they were meaning either, because we haven't made that distinction about who are frontline emergency workers that have to go to work versus everybody else. We're asking everybody to go to work, right? We want people to go work from home if you can, but then go home. So I don't know exactly what the senators mean by that. Certainly one of the things, if they're meaning some of the other things like you just suggested with regard to like healthcare workers and police and firefighters and EMTs and that sort of thing, we certainly are prioritizing those folks first because those are the folks who are interacting directly with people in our healthcare system who are more likely to be COVID positive and that sort of thing. So that's why we prioritize them with regard to testing or our lodging program and that sort of thing. And we will have additional programs more for the general public that will come out down the road as we're ready to announce those things. But I think we prioritized appropriately.
Last question.
Last question, Lee.
That phone call in just a few minutes with President Trump and the other governors. If and when you were to say, we're looking to ease some of these restrictions, you have this 21-day plan in place, you have DHMs. If you were to say, we're gonna try to pull back these restrictions in the next few weeks, it looks like the numbers are helping us in this cause. Would this be something that you're willing to do to step over the 21 days in the DHM kind of thing?
Well, again, we'll be collaborative with our federal partners. Again, when the CDC, for example, came out with guidelines, we've generally tried to follow those guidelines. We've got a plan in place till the end of April. We don't plan on changing that. Again, this is the whole, 21 days to stay healthy, stay home, stay connected, our 6 rules. We are going to be sticking with that plan through the end of April. And as we, approach the end of April here, we are going to be looking at, are there things we can do to restrict some of these, things that we put in place. Some of our DHMs, for example, expire April 30th. So we're going to be looking at all those sort of things. And again, we expect that the president's going to be supportive of the things we're doing in the states because every state's going to be different. He said that many times, that states need to manage it based upon their own specific conditions and what they've got going on in their state. He's a federalist. This is probably the most federalist administration I have seen since Ronald Reagan. So he's a big believer in states' rights. I expect that that's what we'll continue to see. Now, I know the president wants to open up the country. Everybody does. But we got to do it in a way to make sure that we don't allow the virus, and especially in Nebraska, to come back and start spiking in our state and overwhelm our healthcare system. That's what we're going to be continuing to focus on. Well, folks, again, thank you very much. I appreciate everybody coming here. We're going to continue what's doing right for Nebraska. We're going to continue to focus on our social distancing and our 6 rules. We will be back here tomorrow, again, returning back to the 2 p.m. Central Time, and I'll be on NET tonight for a town hall. Thank you very much. Appreciate you all. God bless, and we'll see you tomorrow. Thanks. Thank you, Commissioner. Appreciate it. Thank you. Got this here. John, we have hand sanitizer there.